know. It's Tuesday, and Tuesday means...
I have to do this video to get it over with in a hurry.
Trash Talk Tuesday. So, Trash Talk Tuesday is the day we pick a topic, we trash it, you get to watch it if you want. And here we go. Alright, so Dr. Murphy, today I thought we could talk about how insurance kills your ability to practice medicine and diagnose as you see fit.
Well, it does, because they all got their hand in it, and they want to tell me how to practice medicine and what test I have to order. You know, the whole industry's been squeezing physicians and hospitals and other providers. It's just not doctors, because it might start there, but it trickles down. It's doctors, okay, the nurses are going to get squeezed. We're all getting squeezed here, okay? So if a patient comes in, they have insurance, okay, and I'm like, well, gosh, you know, I think you really need an MRI. The insurance company gets on the phone and says, oh, no, did you try physical therapy? No, because this guy's foot's dragging, he can't move his arm. I think he probably needs an MRI. Well, we have to get that pre-authorized. We're going to get back to you in 7 days. And so this chart has to stay on my desk, and we got to constantly call them, constantly harass them, because they'll never call us back. We got to call them back. I mean, the whole thing's an absolute nightmare. I am so sick and tired of insurance companies. Then, to make matters worse, now I'm going to trash a couple of local hospitals we have here.
Oh no, don't say their names.
Not going to mention my names. There's only 2, okay? So, if you're not employed by either one of these facilities, you can't get access to their insurance contracts. They won't let you have them. And they don't really care. I mean, they don't care.
What does that mean, insurance contracts, just so that everybody knows?
Well, certain hospitals in this area, they either have a Blue Cross Blue Shield, Coventry, or some other form of insurance, but they hold a contract exclusively. And they're the only ones that can allow you to see their clients. So if you're not either A, on staff, or B, employed by them, you're not seeing those insurance patients. Even though you might be a better doctor, be able to do it faster, cheaper, quicker, more efficient. Sorry. So I don't want to be employed by them. I really don't want anything in the world to do with them. So
yeah.
I've always...
And that just ultimately sort of hurts the patient.
It does. Because
once again, big organizations get together, they make decisions that affect everyone, limiting your choices, limiting your ability to really put your health in your hands and those decisions in your hands.
In this particular area of Missouri, it's really bad. Other areas of Missouri are not so bad. So this is not endemic to every community or city in the state.
But it's not uncommon anywhere.
And no, it's pretty common. And there was a bill that was going to be signed into law, and I really liked it. It was called Any Willing Provider. In other words, if the provider accepts what the insurance companies are wanting to pay or do or allow or not allowed to do, well, then you can sign up for it. That thing was killed in a heartbeat, so to speak.
I'm sure.
And they're not giving up their edge. And that's unfortunate, because I think it's really a disservice to everybody in the state. But healthcare is going down the tubes. When I used to practice this thing 30, 40 years ago, I've been in this a long time. It was actually kind of fun and enjoyable, and we could do what we thought was in the best interest of everybody involved. Not anymore. I don't know of a single physician that doesn't have these same gripes I do. And whether they're working for the hospital or not, they're still going through the same headaches and troubles that I have to go through. So it's a mess.
Yeah, it's a real bummer.
Yeah. If you're a healthcare insurance person out there, I hate you.
Yeah.
I think you're worthless.
Unless you're a good guy.
There's no such thing.
All right. Well, I can't think of anybody off the top of my head who is, so I don't feel offended.
Well, that's not so much. I'm not talking about the people that sell health insurance. I'm talking about the person on the other of the phone that I have to talk to that has no knowledge of medicine, and I have to sit there and explain to them why I need a test or why they need this particular drug. I mean, it's a mess.
Well, it's just like anything else. You have your boxes to check.
They do.
And then you have individuals who are only programmed to understand what is required to check that box and don't have what you're saying, the ability to understand medicine in the full scope of what that might mean. Meaning you can get creative with certain diagnoses to help certain types of things. And that person only knows what goes in this box, period. So anything outside of that is not only not advised, but not, I don't know what the appropriate, approved.
Let me give you an example. I get on the phone and I can sit there and say, well, I don't need x-rays, I need an MRI. And they'll argue with me up and down till hell freezes over about it. I'm like, okay, well, let me talk to the doctor that you have. Well, we don't have a doctor.
Yeah.
Then why the hell am I talking to you?
Yeah.
Yeah, because you don't understand a clue what I'm trying to do here.
Yeah.
So it's a mess.
Yeah.
I hate all insurance companies.
Essentially, you're wanting something that can help this patient in a way that's just not necessarily common.
Yeah, and believe it or not, the one that's actually the easiest to work with is Medicare. Because they're straight up tell you, we're not going to pay for it. But they don't. There's no real pre-authorization where they either do or they don't. So,
yeah.
And if they don't, guess what? You got to pay for it.
Yeah. Well, it's fun stuff.
I hate insurance. I hate health insurance.
I think most people
I think it's a racket. I think it's a rip-off. And everybody's got their finger in that pie. So
it's all about that money.
It is. And, everybody's to blame for it. I think we've had this conversation before. The hospitals are to blame. The doctors are to blame. The insurance companies are to blame. The patients are to blame. Here, if you got health insurance and say your insurance covers you 100%, but you have to go to the doctor's office and you have to pay 30% out of your pocket. But if it's an emergency, you get it all for free. So where do they go? Emergency room. So they don't have to pay anything. I mean, the blame's everywhere. Mm-hmm. And I don't see it getting fixed before I retire. Mm-hmm. So.
Well, dang. I guess that covers that.
Yeah, it kind of got me on a nerve, didn't you?
No, I think it's good. I normally would probably jump in and be all wound up about it, but I'm really feeling draggy today. So.
Yeah, why don't you go and take a nap?
Would you let me leave and go over and take a nap?
I'll let you go and take a nap for the next couple of weeks.
Okay. Well, guys, I hope you enjoyed this trash talk.
I could use the break.
I guess I won't be seeing you for a couple of weeks.
Awesome.
All right. Well, have a good week, and we'll see you Friday for Free Advice Friday.
See you then.